Hello and welcome to another episode of the Sports Medicine Moment. My name is Phillip Adler. I'm the manager of our sports medicine program here for the Spectrum Health Medical Group. Today we're going to talk about another one of our winter sports. It's wrestling, one of our Olympic sports, very popular. Specifically, I want to talk about shoulder instability and shoulder injuries. Oftentimes you see guys and gals nowadays rolling around on the mats and somebody goes Gumby and their arm goes behind their head and you hear a loud scream or a yell. Don't really often know in the stands what that means, but as an athletic trainer I can tell you I've seen a number of times where that shoulder's popped out or my athlete has said, hey, I think my shoulder slipped. A subluxation, where it feels like it slipped out but hasn't come all the way out. A dislocation is where it is all the way out and it stays out, and oftentimes those need to be reduced in the emergency room. The key to these injuries, whether it's subluxation multiple times over a period of time, or a dislocation, is afterwards we need to let that shoulder calm down. We need to let it heal. Depending on your doctor that you go and see, and make sure you do get this treated, they may have different protocols, whether it's 2 weeks, 4 weeks, when do we add in the exercise. But essentially we need to let that shoulder capsule, those muscles, tendons, ligaments in your shoulder, tighten up, so to speak, so that shoulder becomes more stable. Failure to do that will lead to an unstable shoulder in the future, and we can almost guarantee that you'll have problems and need to see somebody probably for some sort of intervention in the future. So if you take care of your shoulders on the front end, chances are on the back end you'll be much more successful over the long term. So thank you very much for tuning in to another Sports Medicine Moment. This is Phillip Adler with Spectrum Health Medical Group. Don't forget to follow us on Instagram and Twitter at SHMG Sports Med, and we're also under the hashtag Back in the Game.